for today, we're going to talk about differential diagnosis of plantar fascia. This is for all of you guys who have been experiencing some confusion with regards to whether or not you have plantar fasciitis or not. So we'll be tackling other cases that looks like plantar fasciitis, but it's actually not. So what we're going to do in this video series is we're gonna divide it into three systems of the body. So one is the neurological system of the body, and then second would be the muscular and soft tissue system of the body, and then the third one is going to be the skeletal system of the body. So our foot pain could be caused by a neurological system issue. So meaning it's a nerve problem occurring around your body that is actually causing or giving you some symptoms around your foot. Could also be coming from the musculoskeletal or muscular system or soft tissue, wherein the muscles around the foot or soft tissue structures around the foot is causing you trouble. It might not be plantar fasciitis per se, but other structures around the plantar fascia or around the foot. And then third is skeletal. So it could be a bony issue or a bony problem, or a joint issue or a joint problem, wherein there's specific problem in your skeletal system. For example, you have fracture, or there's a specific problem in your joint. For example, you have arthritis or whatnot. So it could actually be mimicking plantar fasciitis symptoms, but it's actually not. So we're here to discuss all of it, how you can differentiate it to plantar fasciitis so that you won't have that confusion anymore. And once you know what your diagnosis is or what your problem is, that's where the start of fixing starts to happen. So once you know what you're actually fixing, that's wherein you can actually fix it. So you cannot fix a problem that you do not know. Hopefully, you guys, this will help you, all of you guys, to destroy that confusion so that you can attack your foot issues right away. So by the way, guys, this is me, Gorby, and I'm a physical therapist. I'm here to provide you videos or content that can help you and your body live a life that is pain-free. So if you wanted some exercise tips like manual therapy or movement exercises, just please click, guys, that subscribe button down below, and then click also that notification bell so you won't miss out on all of the videos that I will put up. So again, guys, this is going to be the second video content for our series on plantar fasciitis. So I'll be creating a series with regards to how you can completely or totally get rid of your plantar or heel pain. So this is the second part of it. So I hope you watched the previous one before diving into this one. So let's get to it. So guys, please watch until the end of this video, because what you might be having right now is actually not PF. And it's very good for us to look into other cases so that we actually know what we're treating, because if we don't know what the actual problem is, it's going to be very hard for us to guess on what type of treatment will work for us. So please watch, guys, until the end of this video. You might be experiencing one of these problems, and I hope I can give you guys some clarity if what you're experiencing is PF or not. Alright, so the first system of the body that I would like to focus on is actually the neurological system, meaning all the nerves and stuff in our body that could be actually the one causing you pain on your foot, but it's mimicking as a plantar fasciitis. With regards to the neurological system itself, there are three factors that we can study and look at, and it could be the one causing you foot pain. So number one that I would like to tackle on is lumbar spine issues or back problems or disc problems or sciatic nerve problems. So this is the number one thing that neurologically that can mimic as a plantar fasciitis, but it's actually not. So if you look at it, our lumbar spine houses the nerves that runs on our feet. So if one of the nerve roots on our low back is compromised, for example, the nerve root that is supplying our leg or foot, you can have symptoms on your foot, but it's actually your back that has a problem. So you wanted to objectively look at your back and see if it's the one causing you foot pain or not. So very simply, first, you have to notice the type of pain that you're experiencing. For all neurological cases, for all neurological symptoms, the pain or the discomfort is described as a tingling sensation, numbness, or burning sensation on the area that hurts. The pain is also diffused, like it's not located on one specific spot. There's an area that it covers, and you will feel that numbness, burning, or tingling sensation if it's a nerve issue or the problem is coming from a neurological source. So you may also do some self-assessment on your body to check whether or not your foot pain is coming from your low back. So just simply bend over your body while keeping your knees straight. Try to reach down to your toes and then observe whether your symptoms, your foot symptoms, increases or not. And then coming back up, slowly extend your back by placing both hands on your butt cheek, and then extend your low back or extend your whole back, trying to bend backwards, and then see and check if your symptoms will increase or not. So if your symptoms increase or if your symptoms decrease, there's a high chance that the foot pain that you feel is related to your back. So you might want to have your back checked for some disc issues, lumbar spine, disc degeneration, to see whether you have it or not. Once you rule out back issues, or once you know that your issues is coming from the back, you might want to focus your treatment on your back instead of your foot. So for lumbar spine related issue or disc related issue, you may check out here above in the link for some exercises that you can do for you to alleviate disc issues or back pain or foot pain that is coming from your low back. Now moving forward, your foot symptoms could also be coming from your hips. Mainly, your sciatic nerve could be impinged around the hip area, and it's mimicking as a foot pain or foot problem. So mainly, again, what you will feel here if it's a neurologic issue is there's a tingling sensation, numbness, burning sensation on the soles of your foot. So mainly on the nerve roots that it innervates. So you may check that out here. Again, if it's coming from your hips, mainly your piriformis muscle is the one causing you trouble. So the piriformis muscle is shortened and it's decreasing the space on where the sciatic nerve exits. So the sciatic nerve is being compressed and thus causing symptoms along where that nerve supplies. So up until the foot, that sciatic nerve can innervate or supply. You might experience foot pain, although what your problem is sciatica. So what you can do is loosen up that piriformis, increase relaxation on the muscles of your hips through some stretches and some core work, core strengthening exercises for you to alleviate the foot pain mimicking as plantar fasciitis. So if you actually look at it, all the nerve issues is coming from an impingement issue. If you take a look at this wire right here, so for example, this is the nerve and it supplies, for example, this area of my body or this area of my body. If the nerve is compressed here, something is being compressed here, you have to get rid of that compression for you to free up that nerve. So what you can do is, so the solution for nerve issues or nerve problems is to free up that compression or that cause. So if it's from the low back, it could be your disc that is causing this one. If it's a disc herniation, it's causing compression on the nerve or on the nerve root. Could also be coming from an intervertebral foraminal compression, meaning the spaces on your low back is shortened or got smaller. That's why it's causing also compression on the nerve. If it's from the hips or piriformis, the piriformis muscle is tight and it's compressing the sciatic nerve like this. So relax this one, free this one up so that that nerve can supply its sensory functions properly again. What you can also do is try to mobilize the nerve, which I will explain in much more detail on the exercise section of this video series or this video content. So if it's compressing here, there's actually two solutions. So one is remove the compression. So remove this one by doing some exercises or some manual therapy treatments. Or what you can also do is mobilize the nerve, meaning move that nerve away from the compression. So it could be healthy once again. So I'll teach you some nerve mobilization exercises just in case your foot symptoms is coming from a nerve issue rather than your plantar fasciitis. Now going down, so we started from the back and then we finished also the hip. Now let's go down to our foot. So there are also nerves that can be compressed around the foot area, and it's mimicking, or it looks like a PF or plantar fasciitis, but it's actually not. So it could be compressed on the tarsal tunnel. So I'll show you here what tarsal tunnel looks like, or it could also be compressed on the bottom of our foot. So there are also nerves that can be compressed that directly innervates the sensory function on the bottom of our foot. So if they are compressed, so it can also cause symptoms. So let's talk about first one. It's called a Baxter's nerve irritation or Baxter's nerve compression. So it's the compression of your lateral plantar nerve, which supplies the outer part of our foot and the fourth and fifth finger of our foot. So if the nerve there is compressed, that lateral plantar nerve is compressed, it can create symptoms on your foot. It's a burning, tingling, numbness sensation that you will feel, and it's mainly located on the outer side, sometimes on the inner side of the foot if the medial plantar nerve is affected. But the way you separate it or test it, that it's a Baxter's neuroma or Baxter's nerve compression, rather than PF, is for you to actively move your toes. Open up your toes like this. If these two toes of your foot cannot move, it could actually be a sign or a symptom that it's a nerve compression on the lateral plantar nerve. It's a lateral plantar nerve compression rather than PF or plantar fasciitis. Now, it could also be compressed on the tarsal tunnel area, not actually in the foot, but more around the ankle part. So on the inner side of the ankle, there's a tunnel there wherein the tibial nerve passes. Once it compresses, it creates that tibial nerve compression. What you will feel is a burning, tingling sensation on the whole part of your foot, if it's a tarsal tunnel syndrome. Now, the way you differentiate it is, for number one, for PF, it's mainly common to have a first step pain in the morning. So if you don't have that, there's a chance that what you're having is not PF at all, but could be something else. Now, for tarsal tunnel, what you can do is test your foot. So if you move, so for example, this is your foot, right? If you move your foot going this way, so it's a dorsiflexion of your foot, plus eversion, so moving your foot this way. So if you place your foot like that, it will create a stretch or more compression on that nerve, and then you will feel an increase in symptoms if it's coming from a compression of the tibial nerve on the tarsal tunnel. So that's one test that you can differentiate if it's coming from tibial nerve compression or if it's coming from a lateral plantar nerve compression. So for lateral plantar nerve, just move your toes going this way. Check if this two moves. If it moves, there's a high chance that it's not a Baxter's nerve compression. For tarsal tunnel, so what you can do is move your foot going this way and then turning out, and then see if your symptoms will increase. If yes, it could be coming from your tarsal tunnel. Now, for tarsal tunnel, the main root cause of the compression on that tunnel is the lack of space on the inner side of the foot. So it mainly happens if your foot posture is overly pronated. Your toes are turning outward, and then your arc is collapsed, and then your foot is spread outwards like that. So there's no more space on the inner side of the foot for that nerve to pass. That's why it's being compressed there, and it's creating symptoms on your foot. So that's it, guys. So those are the most common differential diagnosis or diagnoses that mimics plantar fasciitis. So for neurological cases or for the neurological systems, it could either be from your back, it could either be from a compression on your hips, or it could be either a Baxter's nerve entrapment under your foot, or it could be a tarsal tunnel entrapment. So there are actually 4 things. These are the most common ones that you can actually look into if you think that your foot problem or your PF is coming from a neurological source. But then again, guys, it is best for you to have it checked by a professional for them to do a proper assessment on you. But if you don't have access to that, these are the things that you can do on your own at home, so that you might not be confused on whether or not you have PF or not. Okay, now guys, our foot pain can also be coming from musculoskeletal in origin or soft tissue. Structures around your plantar fascia or around your foot could be the one that is affected, and it mimics as a plantar fascial issue or plantar fasciitis. We will look at 4 differential diagnoses or 4 diagnoses that could most commonly mimic a plantar fasciitis, plantar fascial symptoms or plantar fasciitis. So yeah, let's dive right into it. So the first one that we're gonna look at is your fat pad atrophy. So there's a cushion underneath our foot, which we call the fat pad, and it gets irritated or it degenerates through time. So whenever we bear weight on our foot, that fat pad provides cushion on our foot so that we won't feel the pressure all the way to the bones of our feet. If you have an irritation on the fat pad, or if you have degeneration of the fat pad or atrophy of that fat pad, what could happen is when you try to bear weight on your foot, you will feel as if the bones of your foot is touching the ground. So that's one of the classical symptoms or signs if you have a fat pad atrophy. So you will also feel very tender on your foot, on the balls of your foot or on your heel area when you try to press on it or really put some pressure on your heel. It mimics as a plantar fascia, but usually for fat pad irritation or fat pad atrophy, there's absence of that first step pain in the morning, which is very common in plantar fasciitis. But whenever you bear weight on your foot, you will feel that your bones on your ankles or foot is really touching the ground. So that's how you can differentiate it with PF or plantar fasciitis. Next thing we're gonna look at is the bursa on the back part of our heel. If you feel pain on the back part or on the back side of your heel, you might be experiencing what we call a retrocalcaneal bursitis, meaning there's an inflammation on the bursa located on the back part of our heel or the calcaneum. So what happens is this bursa helps decrease the surface friction between our Achilles tendon and calcaneus bone. When this bursa is irritated, so for example, whenever we move our foot going this way a lot of times, so that bursa is irritated and it could happen that you will feel inflammation on that bursa. So what you will see is on the back part of your heel, there's indentation on the heel part, so that's where you can actually check and look if you have retrocalcaneal bursitis rather than PF or plantar fasciitis. So if the location of the pain that you feel is on the back part of the heel, more often than not it's not PF, but it's coming from the bursa in between your Achilles tendon and calcaneum. That's how you would differentiate it from PF. So there's absence of that first step pain, number 1. And then number 2, the location of the pain is on the back part of your heel. Now, the way for you to treat this one is for you to actually stretch your calf increase flexibility on your calf so that there's more space for that Achilles tendon to calcaneum movement, so that your bursa won't be irritated and it won't cause you pain. And also, you have to manage that swelling on the bursa by putting ice on it as often as 4 times a day for 15 minutes. That can help you decrease that pain right away. Some people have it but don't have some people actually have this diagnosis but don't experience pain. It's actually okay. For some people, it irritates them so much for years or months now that the only solution is surgery. So sometimes it could happen, but it's really just a small surgery, so it's not gonna cause a lot of side effects on our body if you do it. But if you can go for conservative management by increasing the flexibility on your calf muscles, on your sole use muscles, I'll show you also those exercises on the exercise section of this video. You will definitely feel a big relief on that back part of the heel after some time that you do those stretches or movements. The third thing that we want to look at is our Achilles tendon. So our Achilles tendon, which is located on the back part or the back side of our ankle. So it can get irritated. Sometimes people think they're having PF, but they're actually having an Achilles tendon issue or Achilles tendon problem. The way to differentiate it is very simple. You just have to check for the location of the pain. So if the pain that you experience is on your foot, it could be PF. But if the location of the pain that you're having is on the back part of the ankle, on that heel cord, it could be a problem on your Achilles tendon. The way to manage Achilles tendon problems or Achilles tendon issues is to give it some eccentric strengthening exercises, meaning a slow lowering exercises for the calf. You will raise your heel up and then slowly go down. That's wherein you can try to rehabilitate or improve the condition of that tendon itself, which I will show you on the exercise series also of this video. And also you have to work on the posture of your foot, meaning if your foot is overly pronated or your foot is overly supinated, you have to work on that, because that's where the problem starts for Achilles tendon. So if your foot is overly pronating or your foot is overly supinating, the distribution of force on your Achilles tendon and your plantar fascia is not distributed properly. Once it's overloaded by too much load, it will create pain, it will create discomfort, it will create inflammation on the tissue on your Achilles tendon, or it could also create that deformation of the collagen fibers, because your Achilles tendon is also made up of collagen. It would create that and it will experience pain. Again, it's a signal to our body, it's a signal from our brain to our body that something is not right with the activities that we're doing or with the posture of our foot, and we have to do something about it to completely fix the problem. Now, the last thing that we're gonna look at is if you have pain on the inner side of your foot or ankle and your tibialis posterior, which is located on that side, is having some problems or dysfunction. So the last thing that we're gonna look at is tibialis posterior dysfunction or posterior tibialis dysfunction. So this muscle is mainly responsible for stabilizing our foot and lifting our arch up. And if this tissue is working too much, or there's an increase in tension on that tissue, or actually the reverse, so it's weak and there's no tension on that tissue, you might experience pain on the inner side of your foot. The way to differentiate it from PF, again, there's absence of first step pain in the morning, so usually it's present with PF. But if not, don't discard it yet. You may do also some tests for you to check if it's coming from your tibialis posterior, which is a heel raise. So when you try to raise your heels up, the normal mechanics of our foot, so our foot should go inward, so our calcaneum or our heel bone should turn in at the end range of that heel raise. Now, for those who are having problems with their tibialis posterior, that hind foot cannot turn in when you raise the heel up. Or it can turn in, but you will provoke the symptom so much, and it's actually very evident because the pain that you feel is a line pain all the way from the origin of the posterior tibialis tendon all the way to the inner side of your foot. So that's how you can differentiate it with PF or plantar fasciitis. Now the way to fix it, also very simple. So work on the posture of your foot. Usually you're overpronated when you have tibialis posterior dysfunction. So work on the posture of your foot. I'll give you very effective exercises for that on the exercise series of this video. And also you have to strengthen that muscle, which I'll show you also in the strengthening exercises part. So you have to strengthen your tibialis posterior or posterior tibialis for that dysfunction to go away. It's the same thing with, it's actually the same rehab principles with Achilles problems or Achilles tendinopathy, but the location are different. So with Achilles tendon, it's on the back part of our ankle, so it's on the heel part. With the tibialis posterior, it's on the inner part or inner side of our foot. So that's how you will differentiate it. And guys, just a reminder, if the type of pain with people who have neurological source experiences is a numb, tingling sensation, burning sensation type of pain, for those people who are experiencing musculoskeletal or soft tissue problem, it's more, the pain number one is much more precise. It's not spread throughout on one area, so you will feel it directly on the spot wherein the problem is or where the pain hurts. So you will directly feel it on that specific spot. And the type of pain that you feel is a sharp aching, dull aching pain on the area that hurts. All right, so the last system that we're gonna look at is the skeletal system. Our foot problems could also be coming from a bone source or a joint source. So meaning, again, like what I gave you guys as an example earlier, it could be coming from a fracture. That's why you feel pain. Or it could be coming from a joint arthritis and it mimics as PF. With this one, guys, with skeletal source as the pain, so more often than not, there's no first step pain in the morning, but the symptoms are somehow almost the same. All right, now let's dive into it. So there are three diagnoses that we're gonna look at right now. So one is calcaneal fracture. So if you have fracture on your calcaneum or on your heel bone, you will feel extreme pain. It's basically it. It won't stop even though you don't put weight on it. So even though you just hang your foot there, you experience pain. You will also feel extreme pain at night. So that's also one of the classical signs of a fracture. You actually won't dare to put weight on that foot because you know how painful it will be. If you have a fracture, that's what it looks like compared to PF, in which you will still try to walk, but you're gonna be on your toes. You're gonna be toe walking, but still you can tolerate weight on your foot. With fracture, you won't even dare to place weight or put weight on that foot. Also night pains. But then again, if you suspect this, if you have these types of symptoms, go to ER right away and request an x-ray or go to an orthopedic doctor for them to have it checked if what you're having is a fracture rather than PF. For these types of scenarios also or cases, there's a trauma that happened. So there's an accident that could create that break on the bone. That's why you will feel pain. But the area where it hurts, it's directly on your heel part. So it looks like PF, but it's actually not. Now, the way also to differentiate it is with the type of pain that you experience. So if it's a deep nagging pain, it might be that the pain that you feel is coming from your bones. So you have to check. You need secondary ancillary procedures like x-ray for you to confirm if what you have is actually a fracture and not PF. Also, guys, if it's a bone issue, the pain that you feel, it will be very tender to touch, especially if it's a fracture. So the pain that you feel is very tender and it's kind of extreme, way different than a soft tissue or muscle problem or a neurological pain. So it's an extreme pain. One small touch can create massive pain, and it's a deep one. So you will really feel it deep and extreme, dull, boring, nagging pain deep inside your foot. The next one we're gonna look at is what we call subtalar arthritis. The symptoms, that the area where you will feel the pain if you have this type of arthritis or subtalar arthritis is also on the heel part, in between your ankle and heel. It's also a massive pain. So whenever you bear weight on your foot, you will also feel that pain on your heel if you have subtalar arthritis. Okay, so this one usually happens after a trauma or a fracture. Unfortunately, the way for you to know whether you have it or not is for you to have your body checked and have an x-ray. So I'll show you an image on what it looks like. What happens is there's degeneration on the cartilage of that joint. That's why it's causing you pain. So there's bone-to-bone contact between your talus and your calcaneum, which forms your subtalar joint. So there's bone-to-bone contact there, and it creates also a massive pain on your heel whenever you try to put weight on it. You can treat it conservatively by doing some exercises on the foot, improving the posture of your foot, but the exercises will only work to some degree. It will not actually fix the problem. There's actually no 100% cure yet for this type of problem or for this type of diagnosis. Although there are some surgeries now available, so there's subtalar fusion surgeries, which helps improve the contact on that joint. But I am not 100% sure what the outcomes are with regards to the patients who've done it. Now, there are also a big demographic or big population of people who have it, but they can live with the pain. Also, through medication, they can actually live with the pain and actually opted not to do surgery, and they just decided to live with the pain. Exercises can help this type of demographic, but then again, I cannot assure that you can reverse it or there's gonna be absolutely zero pain in a day. That's what's really unfortunate if you have this type of case or this type of problem. Okay, so the last part on the skeletal system as the source of pain or foot pain is something that occurs in children. So if you're not a child watching this video, so you might not actually have this one, but probably growing up you experience it if you have foot pain right now. So it is what we call Sever's disease. What happens is the attachment of that Achilles tendon on the back part of the heel pulls on the growth plate of that calcaneum or heel bone, and thus it also creates pain on the back part of your ankle, much like a retrocalcaneal bursitis. So the way to actually differentiate it from PF is very simple. Again, it's with the location of the pain. If it's from the back part of your heel, you would think of retrocalcaneal bursitis or Sever's disease. That's one. And then second is the absence of the first step pain in the morning. Now, the way for us to basically treat it is, number one, to let the inflammation subside and control it by using ice or some other modalities that can decrease, or medications that can decrease inflammation. And then second is you have to train the calf muscle to work on an eccentric manner, so much like the treatment or the exercise for Achilles Tendinopathy. So you would have to work on that, plus also improving the foot posture. So meaning if you're overly pronated, we have to do some exercises to correct that. If you're overly supinated, we do the reverse of that exercises. Also, you have to improve the mobility of your ankle and for you to completely alleviate the pain and the problem that you feel if you have a Sever's disease. So there you go, guys. Those are the things that could be misconstrued as a PF or as a plantar fasciitis. We've discussed 10 differential diagnoses for PF. So hopefully you can now determine or check if what you're having is PF or not based on the discussion that we have right now. If you're still unsure, you can have it checked, or you can do an online consultation with me. Just fill up the form down below and I'll be happy to do an online consult with you for us to look further to your pains and discomforts. Now again, this is the second part of our series for PF or for plantar fasciitis on how we can totally get rid of that heel pain. So we've discussed what the plantar fascia is, what it is, why it hurts, and what's the function of it, why it matters. Right now, we've discussed some of the cases that can be misconstrued as PF or plantar fasciitis. Now the next point that I'm going to make is how our weight is affecting our plantar fascia. It's a very exciting discussion, and I would love for you to actually dive also into it. Watch it until the end, like this video, because if you're still watching right now, so you've watched until the end. So thank you guys. Please don't forget to like this video and comment on the comment section down below what you think of it. And if you have some foot pains or foot problem, you can just go to my online consultation form, and I'll be happy to get to know you and help you with your foot pain or foot problem. Bye guys.